Treatment of diabetes mellitus. So treatment with the diabetes mellitus, here we make sure the first thing, once you are diagnosed with diabetes mellitus, the first thing is to work on to start doing exercises, not class exercises. These are physical exercises. The physical exercises you carry out here, you have to start exercises. Like you can start running every morning. You do something. Some have punching bags at home. You do like a bicycling. You get your bicycle, start riding. There are so many ways you can do it. Actually, exercises. The importance of doing these exercises. Once you do exercises, the body will need body cells will start demanding for glucose. So the glucose which is in the blood saturation will now be facilitated to enter into those cells and leave the bloodstream, hence lowering the blood glucose. And these exercises, they increase the sensitivity of insulin in the body. So, as in the process, it lowers the blood glucose level in the bloodstream. So, some people, you find that it is hard for you to do practices, to do physical exercises, just because you are not used. So, what you do, you first start slowly by slowly. As time goes on, you start becoming used. Actually, we even advise not to oversit for a long period of time. If you sit like for 30 minutes, you a diabetic patient, it's not good. Sit for about 30 minutes. When you see that you have sat like for 30 minutes, stand up and have a walk around. Just have a walk around like that, then you come back. Get somewhere, you be like a move and you rotate. You can rotate around like for a period of like the size of a pitch, a football pitch. You rotate around such an area. You see it. You start making practices slowly by slowly. Do things that can make you sweat, things like that. So that's one way of managing the blood sugar. Then the second way of managing diabetes mellitus. Actually, this should be management and treatment of diabetes mellitus. Now, the second way we can treat or manage, here we are first managing. You can manage. There are some people like those who are in, as we saw in our video of the way we diagnose and test for diabetes. We saw that there are some people we call the pre-diabetic patients or people. So these pre-diabetic people, they have high chances of controlling their blood glucose even without taking medications. So one of the ways you do exercises, as we have explained. Another thing, you control the dietary. Dietary changes. You change in your diet. You do what we call, you take a diabetic, there is something we call a diabetic meal or food plan. You do a diabetic food plan. How do you do it? Make sure that what you eat more of the fruits. Eat more of the fruits, eat more of the vegetables. Then eat more of the lean proteins. So make sure that you can even include the grains. Actually, they are called whole grains. So these ones they are nutritious, but they don't have fats and calories, which can which can increase your blood sugar. These ones they are nutritious, but have no calories. So these foods are good. They are the best, by the way. So actually, most of the people like us in Africa, our country. When I go to our countries in Africa, you find that they have more of the fruits, vegetables. They have the grains in plenty. Actually, they are fresh. Even these proteins, of course, they are there because they do a lot of the work they need. So another thing in diet right here, some of the people they have they hire somebody they call a diet a dietitian who tells them how to eat, measures carbohydrates, their carbohydrates, just to help them to have a meal that cannot compromise them, that cannot disorganize their blood sugar levels to elevate it. So with that, make sure that you avoid the so-called saturated fats. Avoid saturated fats, avoid the sweets. Sweet things, they are not good for diabetic people. Make sure that you avoid the refined carbohydrates. Yeah, the third part is not only managing, but also treating. Actually, the third is use of insulin. Insulin injection. So we can manage diabetes by use of insulin injection. This is specifically for this is type 1. We are managing type 1. So this is for diabetes mellitus type 1. You inject somebody with insulin. Now the body of somebody is not able to manufacture insulin. So if it is not forming insulin, you just have to inject that person directly insulin such that insulin enters the blood system and helps to lower the blood glucose level. But now, If you see, sometimes it can go worse and it's no longer working very well. So in that situation, sometimes they do pancreas transplanting. You transplant the pancreas because the pancreas of this person is no longer functional, no longer important to be there in the body. So you remove the one which is not important and you put what is important. So you look for the way of managing this person's blood sugar level, and you see that we have injected insulin. It is nothing special. We just change the pancreas. So they change this pancreas. They remove what is not. They do surgery. They remove what is not functional. They put what is functional. Where they get it from, who doesn't want it, I don't know. So that is one. Then another way of managing or treating somebody with diabetes is by use of oral medication. Oral medication is such as we can do it like a type 2 for, for diabetes mellitus type 2. So for diabetes mellitus type 2, we usually do orals. This one is accompanied with what we studied in number 1 and number 2, where there is exercise and diet. So when we leave that apart, so just know that diabetes mellitus type 2, we manage it with oral medication. But sometimes you find that oral medication only is not working. So you can change to insulin, or you can even use both, because the sensitivity of insulin is not enough. So sometimes you find that you use insulin at the same time you use orals. Orals to make the orals like we can use tablets like metformin. Metformin. You can use tablets like metformin. So these ones, they open up the gates where insulin has to pass with glucose to enter the body cells, hence removing blood glucose lowering, removing blood glucose from the blood saturation into the adipose tissues. So there are some other medications which we can use for for diabetes mellitus, like the SGL, like the SGL, like the the SGL.
The SGLT2 inhibitors.
It's a class of medication that lowers blood sugar by preventing the kidneys from reabsorbing glucose, causing the excess sugar to be excreted in urine. Initially used for type 2 diabetes, they have since have been found to also have beneficial effects on heart and kidney health, even in people without diabetes.
So,
Common examples of these drugs include canagliflozin, dapagliflozin, and empagliflozin, and so many other drugs which we shall look at later, as we shall be looking at in the topic of mode of action of those drugs. Then next,
So gestational diabetes. Gestational diabetes. Now, with gestational diabetes, here, the gestational diabetes mellitus. With this, you can manage it with orals, insulin, or insulin, or both. Can use either oral or insulin, or you can even use both to manage. Actually, with gestation diabetes mellitus, here it is dangerous and bring danger to the baby in that the more glucose level in the blood system, or the bloodstream of the mother, the more the baby produces insulin. So there is too much glucose in the blood of the mother. So it makes the baby also to produce a lot of insulin to fight and close and lower down this glucose. Hence, leading to low, it will lead to low blood glucose. This low blood glucose at birth. You produce a child. When you test that child, the blood glucose is very low. We even need to put more glucose in the baby such that the baby survives. So it comes about by this gestational diabetes mellitus. That's why it is advisable for every mother who goes for antenatal care to be tested for blood sugar. This is what we are. We want to protect. We want to see, is your blood sugar level fine? If it is fine, then it's okay. But if it's not fine, if it is too high, it means we have to do something to make sure that the baby is born in a good environment, peacefully. This was number 5. Then number 6. Monitoring blood glucose is one of the ways of managing blood sugar. Monitor your blood sugar levels. Make sure you go to qualified people. They test you, and moreover, when they test you, they tell you the level you are on, and you must know your blood sugar levels. You must know that if the blood sugar is this, it is normal or abnormal. We have already told you the normal range of blood sugar in our previous video, which we did for diagnosis of diabetes mellitus. So when you see that your blood sugar is not normal, or it is going astray, too much elevated, then what you do, you get advice from that health worker, the one who tested you, or the one who is managing you. Or you have telephone numbers of people. Even me, you can WhatsApp me. My number is always in the video. You can WhatsApp me. Then after WhatsApping me, I can tell you more. I can advise you. I can tell you much about your blood glucose levels and how to manage it. Come, I test you. Some of the people, even I test them for free, who come to my clinic. So that's my what? That my telephone number. The technician will give you the telephone number. My WhatsApp number, actually, because you might be abroad, even you might be just within here or elsewhere. So our next topic, we are going to look at how ketoacidosis affect. We are going to look at ketoacidosis, and as opposed to the other friend of it, there is sometimes we confuse the two. So this time we are going to study them very well, and we remove that confusion. So just stay in touch. You subscribe. When as you are watching this video, on your right, you are holding the phone like this. Then on your right, there is a word written there to this. It is in white. As you are watching this video, this side here, there is a word subscribe. What you do, just put there a thumb once and it will change and bring a bell. After pressing there, it will bring a bell. So if you want to get the notifications every time, press in that bell and it will bring the words. So what you do, press it all. So you have, once you do that, it means that you have supported us. So I remain Dr. P. as usual. Stay tuned. Thank you, guys.